I think residency is a great way to really gain a lot of experience and really gain a lot of confidence as well.
I always knew that with pharmacy I wanted to be in a hospital setting. My mom was a pharmacist, so growing up I'd kind of been around the different types of pharmacy models, whether that's retail, hospital, that kind of stuff. And being in the hospital was something I always wanted. And just seeing what all clinical pharmacists can do was just so incredible to me.
I was kind of a late bloomer in deciding whether I wanted to do residency or not. It didn't happen until my fourth rotation, which was my first rotation in pharmacy school during my fourth year.
I actually did not know that pharmacy residency programs existed whenever I had started pharmacy school. And as I learned about those going through pharmacy school, I realized that I could be challenged clinically.
I've been a pharmacist for a few years in the retail setting, and a friend of mine was telling me about Archbold and suggested I kind of come up this way a couple years ago. I felt it was time to maybe transition from the retail setting to Archbold Medical Center in the hospital. And I felt like they gave me a chance to put together and use a lot of the knowledge we learned in school to be able to put it into practice and to become a great pharmacist.
Typically I'm in our ICU, our critical care unit, so I start my day off relatively early in the morning, just catching up on any orders, working up patients. I typically have a resident or a pharmacy student who I work with in the morning time. We're getting ready for our rounding with our intensivists, our ICU doctors.
We're also following up on patients with their cultures, if they've been discharged, making sure we're on the right medications, should they not have to stay in the hospital and go home early, that we're still taking care of them and watching out for them even as they leave.
And then the end of the day, usually there's some sort of discussion or topic. You find a patient or a disease state that has been relevant recently, and you figure out what the resident knows, what they don't know, and how you can improve that knowledge.
So I've learned a lot of clinical pearls, but I've also learned quite a bit about myself. It's helped me refine my time management skills, as well as, increase my knowledge about patient care in general.
The knowledge and experience that you gain in that 1 year is vast, and it can definitely make you a more well-rounded pharmacist.
We've had several different residency classes, and many of them have stayed on as pharmacists here as well, because we have such a good family nurturing environment, and we all truly get along and provide great patient care and have that relationship with our physicians.
It's been a very easy transition. People that I have met throughout the town have all just been genuinely kind, and it's been a wonderful place to be able to move to.
All the stuff that we have downtown is incredible. The first Fridays, the concerts at the amphitheater.
Great small town feel. Everyone knows each other, and we all work together to take care of our patients.
They've been very supportive in helping me, and I just think it's a great environment. They really want you to succeed here.